We're all human. And it's important to know that doctors are people too. Doctors have emotions, they have passions in life and hobbies, and they enjoy participating as active members in the communities where they practice medicine. Doctors have families, friends, and relationships, while the latest in healthcare and the most current treatments for ailments will be topics on this Doctors Are People Too radio TV show. The focus will be in learning more about the interesting aspects in a physician's life and what they do away from the doctor's office or operating room table.
Hello, South Florida and beyond, and welcome to Doctors Are People Too on iHeartRadio, WWNN 95.3 M and 1470 AM. And we're also streaming live on Facebook Live on AMP2 TV Productions. You can put that right in the Facebook search bar there and follow us live. And I'm here tonight with a plastic surgeon, Dr. Jacob Fryman. Dr. Fryman, how are you doing tonight?
Great. Thanks for having me, David.
And thank you. You are a plastic surgeon in Miami Beach, but you do have some ties to Palm Beach. Thanks again for making the drive up. I guess, yeah. So how was the drive? Was it okay?
There's a lot of traffic on I-95, yeah.
Okay. I actually came from West Boca, so it wasn't bad. I was very surprised, but I'm so happy to have you in studio here. I don't think I've had a plastic surgeon on the program. I've been doing this show almost a year now, so I'm really excited to talk about the different areas of interest and specialties that you bring to South Florida. Now, tell me a little bit about your practice. You are located in Miami. What is a few things you can share with us about walking into your practice? You know, we're on the radio, so if we were to walk in the door.
Well, when you walk in the door, you'll be greeted by the staff there, and they'll show you into a room, and then I'll do a consultation. We can discuss the things that you don't like or that you want to change. Sometimes I'll have to convince you you're fine by yourself, but just the way you are.
Yeah, I've heard that before with plastic surgeons. Sometimes, you know, there's things that just don't need to be changed. And I think that's important to have, you know, a plastic surgeon who will take the time, you know, to tell you that. I mean, that's important. You don't always get that.
Right.
I'm not saying that you don't always get that with plastic surgeons, but just in life.
Right.
So you're located, what is the address of your office?
It's 1800 Southwest 27th Avenue in Miami.
Okay, and if we're not that familiar with the address, kind of give us a landscape of where it's located as a specific intersection, landmark.
Yeah, if you're going down US 1, then you just going south on US 1, you just make a right on 27th and go down. You'd see it on your left side. Okay,
yeah, I'm familiar with that area. Now, what are your areas of interest in plastic surgery?
I do cosmetic surgery at this point. When I do reconstruction, it's usually I do some overseas reconstructive practices like cleft lip and palate and things like that. And I went to Haiti after the big earthquake. But in the U.S., I mostly just do cosmetic surgery.
And now cosmetic surgery, is there a specific part of the area that you concentrate on or specialize in, or is it the whole gamut?
Yeah, so I do everything from head to toe, but nationwide, the most common surgical procedure, cosmetic surgery procedure, is breast. So that's most of what I do all day is breast surgery.
What would you say the percentage would be of breast surgery?
I would say it's probably 70% breast, and then the rest of it, the other 30%, would be a mix between faces and bellies and other things.
Now, is that breast surgery just for women, or do you do a breast surgery for men to, I guess, reduce or change the shape of, some kind of odd shape?
Yeah. So that's called gynecomastia in men, and I do that too, depending on what they need. Sometimes it's just liposuction. Sometimes it's a breast reduction in a man. It's becoming more and more common around the United States. With the prevalence of obesity and the use of marijuana, it's becoming a lot more common.
Really? So obviously obesity, because it's fat, that's the tissue in the breast, right? But why so? Because of the use of marijuana?
So certain drugs do increase breast tissue. Marijuana is one of them, and many of medications do too, like certain ones that are for GERD cause some breast tissue to be formed. And so in a history, you'll always find out about these things. If patients are honest about their marijuana use, then you find out, and that's usually where it comes from.
Wow, I did not know that
It
at
is
all.
very common, yeah.
Wow. And is that because of being lazy, or is it a chemical reaction?
I'm not sure they really know. I don't know the research behind it, why it is that marijuana is listed as one of those things that cause gynecomastia. But yeah, it's become more prevalent. I don't know if it's because of that. You know, I don't have a practice in Denver, but you know, the patients that do come from Colorado are usually women. But you know, that would be a good study to see if it increases breast tissue in men in Colorado.
That would be very interesting research.
Yeah.
I'm sure someone's going to tackle it eventually.
Right.
Do you get a lot of patients from out of state? I guess I don't want to say in a derogatory way, but medical tourism. I mean, does that happen?
Most of my patients at this point come from out of state. I
Oh,
get
wow.
a large number of patients come from Canada, New York, New Jersey. It's changed in the last few years. Originally, it was all from Miami, and now I could say I have very few patients coming from Miami. They do fly in from all over.
Well, that's got to be great to hear as a physician. I mean, you're not only local, but from outside of the South Florida area, and that's got to also be attributed to your your experience and success, because the word gets around.
It's interesting because what Americans want is not necessarily what people from other places want. So, like last week, I had a woman from Nigeria, somebody from South Africa, a Chinese woman, and what they view as attractive is very different than what Americans view as attractive. So you have to gear the plastic surgery towards those nationalities.
Unbelievable. See, that is really interesting. Now, I know you said most of your 70% of your practice is a plastic surgery for the breast. So I would have thought, that because Miami, it's like the hip and glamour area, that most of your patients would have came from there. But that's really interesting. We're here with Dr. Jacob Fryman, plastic surgeon. From Miami. His address of his office is 1800 Southwest 27th Avenue. Phone number is 305-446-7277. And website, I just went on it. Very colorful website. A lot of information is drfryman.com. It's drfreiman.com. If you want to talk to the doctor, we're here at 1-888-565-1470. You can call in and we can get you on the air and talk with the doctor. Now, going back to your office, how does someone start out kind of in going to a plastic surgeon? Are they referred? Are they is it a walk-in thing? How does it work?
So the best patients are the referrals, because they've already done their research. They've spoken to their friends or family, and so they know what they want. And so really the friends or family have done all the research beforehand, so it saves them the trouble, and they're much more confident in their decision. But some people, they just, did research. They went online, they look at pictures, they want to look at your training, make sure that you're a board certified plastic surgeon. And they'll see usually before and after pictures. Of course, as plastic surgeons, we're always going to put the best before and after pictures, so you can't really trust that, but it is a good start just to see that somebody is prevalent. It does a lot of it, and there's a lot of before and after pictures.
And that answers the question, how does someone decide which plastic surgeon to go to? I mean, it's like anything else. You research it, you take the time to take a look.
You can ask your own physician also. Sometimes they'll know who to go to, dermatologists.
Oh, that's a good point. Because I know you treat head to toe, and my story with a plastic surgeon, I'll be happy. I always share my health stories on the air. I had a sebaceous cyst for a few years, and it was just my primary care said, if you want to have it taken off, fine. If not, it's fine too. I mean, it's not going to do anything, but I had it taken off, and I had it on my back, and it really changed my quality of life. So that's something that a plastic surgeon does as well.
Plastic surgeons, dermatologists do it too.
Okay.
Absolutely.
And it can be done right in the office. I mean,
yeah, absolutely.
Okay.
Yeah, all it is just basically it's like an ingrown hair from hell. That's really what it is.
Yeah.
At the end of the day.
Lucky, that's the only one I've ever had. I don't go to a plastic surgeon for anything else. But now, Why is it important to go to now? Let me ask you first. Are you board certified?
Yes, I'm board certified.
Okay. Why is it important to go to a plastic surgeon that's board certified versus one that may not be?
Right. Either board certified or board eligible, somebody that will become board certified. It just shows that they've gone through all the training to become a plastic surgeon. There's a overseeing group called the American Board of Medical Specialties that oversees the accepted, or at least accepted by them, board certification. So your cardiologist would be board certified by the American Board of Cardiology, your pediatrician by the American Board of Pediatrics, and your plastic surgeon should be board certified by the American Board of Plastic Surgery.
Okay, and we saw that in the news with kind of the butt implants that were going on,
Right.
Not only in Miami but other areas where the person doing it may not even been a doctor or surgeon and definitely wasn't board certified.
Right, that's a much worse problem. There are other boards out there, but they're not necessarily overseen by the American Board of Medical Specialties. And then there are the people that just do stuff, and those are the people that come. There was one person that was doing things in a hotel room, and that's pretty obviously dangerous. And I see patients that come in and they ask me to help them with these problems, and a lot of times there's not much I can do for them. Having been injected with some kind of, silicone from a store. So yeah, you just do your research, be smart about it. It is a surgical procedure. Just like any surgical procedure. I know it sounds cute to call it these cute names like tummy tuck and whatever, but it is real surgery. So it should be taken seriously.
Yeah, and I think the substance that they used was like Fix-A-Flat or something.
Right.
Which and it can result in death. I mean, these are
horrible,
harmful substances being put in the body by someone who's not medically trained. We're going to take a quick break, and on the other side, talk a little bit about the facelifts that are available, tummy tucks we mentioned. I want to talk about some other things as well on Doctors Are People Too.
My dad is a cardiologist, and so I have two brothers, and we were all equally painful to my mom. And so to get us out of the hospital, we would go on rounds with him on Saturdays and Sundays in the hospital back in Oklahoma City. And we used to, race wheelchairs down the hallways from the time I was about 6 years old. When I was a freshman in high school, I got to watch my first heart transplant. But I think what really kind of made me want to be a doctor was around the holidays. The house always filled up with tons of gifts from thankful patients, and to impact people's lives like that in a positive manner was something that was very exciting to me. I'm very patient-oriented. I care about the patients both professionally and personally, and not only about their result, but also that I'm passionate about new technologies. I'm passionate about research, and I'm passionate about offering them the best technology available with the lowest risk and with the best outcome. What you want in a physician is someone who is personable, works as a team, embraces new technology, is clearly accomplished, but I think most importantly is somebody who you get confidence in. And the way I would have confidence is if I had a condition, I would read as much about it as I could before I showed up, probably off the internet, and then ask very directed questions. I do a lot of exercise. Running is what I use to kind of calm my brain down and kind of sort my thoughts out. So I enjoy, I just will put my shoes on and go for a run, and then I do mix in a little bit of yoga, something probably not many people know about me. I keep that on the down low, but so I do some yoga, and I go to the gym like most people.
Tenet Florida Physician Services is a multi-specialty physician group providing care to the communities of Palm Beach, Broward, and Miami-Dade since 2007. The TFPS team is committed to delivering quality care. Our mission is to improve the quality of life of everyone who walks through our doors. Today, we are proud to be one of the largest and most respected physician networks in the area. To learn more about Tenet Florida Physician Services, visit tfpsdocs.com. That's tfpsdocs.com. Or to find a doctor, call 1-866-654-2362.
You are listening to Doctors Are People Too with David DiPino, who shows us the human side of medical doctors in the community. If you have a question for our guest, Call into the show at 888-565-1470. Now, let's get back to the fun side of doctors and show that they are people too.
And welcome back to Doctors Are People Too. We're here with Dr. Jacob Fryman. He's a plastic surgeon with an office at 1800 Southwest 27th Avenue in Miami. The number is 305-446-7277. And it's a great website, drfryman.com, drfreiman.com. Dr. Fryman, what hospitals in South Florida are you on staff at?
I'm at Memorial Regional in Hollywood and Westchester in Miami.
Okay, so one in Broward and one in Miami as well.
That's correct.
And I was talking to you a little bit during the break. You have experience. You, at one time, were at a practice in Palm Beach and were on staff at a few hospitals in this area?
Right. So my first practice was up in Palm Beach. I lived in Palm Beach Gardens, and I had a practice in Jupiter. I was on staff at Palm Beach Gardens Medical Center and Jupiter Medical Center.
Oh, wow. And I'm from Jupiter originally.
Love it up there.
Yeah, it's a great area. And my mom still lives up there, so I go up there every Sunday. Now, I want to talk to you a little bit about wrinkles. There's something that, with age, it's inevitable, I think, and there are all kinds of treatments. What are the treatments that you specialize in for wrinkles? And, how as a patient, how do I know what I need from a male standpoint and a female standpoint? We can start with either one.
Yeah, so it's pretty much the same. It's a little bit different. Men's skin is different, but, you have to go to somebody who can sort of do the whole gamut of facial stuff. So every wrinkle has its treatment. And for really fine lines, you can just use certain creams will actually help with that. Or if you want to be more invasive, you could do like a laser treatment or a peel. Plastic surgeons usually do an erbium laser or a CO2 laser, which is a little more invasive. There's a little more downtime, but the results are really nice. And the reason plastic surgeons usually do it is it is a burn. It's a controlled burn. And since plastic surgeons are burn surgeons, then we're pretty good at dealing with those kinds of things. And the results are much longer in that way. Other wrinkles, such as the ones that are caused by your muscles, like the frontalis muscle or some of the glabellar muscles around your forehead here, Botox works great. And or Dysport, whichever kind of botulism toxin you like to use. It's the most common cosmetic procedure in the United States is using Botox. And from what I've heard today, the research shows that it's actually becoming more common to use it for medical necessity than aesthetic necessity now. And then moving up from there, you can start to look at surgery. And so there are many different kinds of facelifts. There's not one kind. For a little while, there was something called the mini facelift, and I would watch out for mini things. There's some indications, very rarely, for something called a mini facelift, but in general, if your face is descending as you get older, then you're going to need a facelift, and there are a few different kinds that work really well. I had a patient last week come in. She wanted a facelift. She was in her late 30s. I didn't think she needed it. I just suggested she do some fillers instead.
Oh, nice. So. Now, let's also talk a little bit about what other people come in to you for, like the fatty parts of the body. Now, you offer different types of lipo. What is laser lipo and Vaser lipo, smart lipo, all these different kinds of lipos?
Right. There's a lot of different kinds. So the original kind of lipo was just sticking a cannula in and sucking out fat, and it was a very bloody procedure, and it was very dangerous. So a dermatologist invented a procedure called tumescent lipo, where fluid is injected in, which has certain chemicals in it that causes vasoconstriction, so you don't bleed, and then sucked out the fat. And almost no blood came out. It was almost all just fat. So that became the classic way of doing it. It's called tumescent lipo. It's worked. There's still nothing better than it, in my opinion. Other modalities have been tried and are pretty common out there, like Vaser, laser, other things. I feel in my hands they have a higher complication rate, so my feeling is that tumescent lipo is still the best way to do it. It has the fewest complications, the least amount of scar tissue, so I prefer to do that. It's also, in a way, cheaper because you don't need the machine, but I've seen some great results with it. Obviously, if you need other procedures, lipo doesn't do it. So if you need a tummy tuck, you need a tummy tuck. But one of the problems that I've seen with things like smart lipo is it causes a lot of scar tissue. The company says that it tightens the skin. I haven't seen it tighten the skin. I've just seen wrinkles become hard because of the scar tissue. So now you have wrinkled, hard skin. But they claim that, and so it's possible. I just haven't seen enough. And then, maybe there are people out there who have seen skin tightening from the smart lipo. So I use tumescent lipo as an adjunct to other procedures. So if I'm doing a tummy tuck, I'll carve out a really nice waist with the lipo at the same time.
Now, what percentage of the treatments you specialize in are done in the office versus the hospital?
And so now almost all of it is done in the office.
Okay.
But there's an operating room in the office. So it's a certified operating room. And so, it's just the hospital. I do some procedures there. So if a patient has any medical history at all, I won't do them in the office. They just have to be very healthy. And so then those I'll do in the hospital.
And what is your team with the operating room on site at your office?
They're between an anesthesiologist and you have a nurse. You have the whole team from an operating room. You can't really just open up an operating room in your office. You actually have to be certified by the state to do it. It's a pretty serious thing. So, I think that with the right team, it's very safe. We haven't had any problems with it. And as long as patients are honest about their histories, then there really isn't any problem. Once in a while, patients don't tell me their whole history and they keep it from me, and there is the potential. But ultimately, between all the checks and balances, we find out what's going on. So.
And Dr. Fryman's office is located at 1800 Southwest 27th Avenue in Miami. Phone number is 305-446-7277. And website where you can learn about everything he does for plastic surgery, reconstructive surgery, head to toe, is drfryman.com. That's drfreiman.com. Going back to the what you do a lot of, you do a lot of everything, but breast implants and breast construction. Now, are silicone implants safe?
Right. So for a long time, silicone implants were performed, and then there was a study which turned out to be a false study, saying that it was associated with connective tissue disorder. So it was banned unless it was reconstruction. It was banned, and for a long time until they found that it just wasn't true. And during that time, the companies they made them better. They made these really amazing implants, and so once it became legal again to use them, the shells were better. The silicone inside is no longer a liquid that can leak out. I have not seen a rupture in 10,000 implants. I haven't seen a single rupture of a silicone implant. And if you do rupture it, if you take it and you cut it in half, it doesn't just leak. It actually is like a solid piece. Even though it feels soft, the gel is actually solid. Now, some people call it the gummy bear consistency, although I wouldn't eat it. And but there's even a video of somebody driving over an implant and it didn't rupture. So they're pretty amazing now. And I have no qualms with using them at all. Although there's no new research that shows how safe they are. So you can't really. So we still say you have to change them every 10 years and you should get MRIs every 2 years. But that's from the old research. And the reality is I think they're much safer now.
Now, is silicone the only substance used in implants today?
So there's saline and silicone.
Saline and silicone.
Patients who are still afraid of using silicone will still use saline. And there's benefits and risks to both of them. Silicone, you need a slightly larger incision to put it in. Saline, you need a very tiny one, but it does have a higher rupture rate. And ultimately, it feels a little like a plastic bag in the breast. So it's not necessarily, it doesn't feel as nice as a silicone implant. Also, from the outside, if you have thin skin, you can feel some rippling. So then you really do feel the implant.
So it's kind of a case-by-case basis. I mean, you, like you said before, with the medical history, you kind of, learn the composition of your patient's body and understand what will be best for them.
Right. Exactly.
Okay. Now, I want to also talk about the anchor lift and something I wasn't familiar with, the term lollipop. I mean, what is the anchor lift and the lollipop?
Right. So if somebody comes in and has something called breastosis, ptosis with a P, is just droopy breasts. You know, in medicine we like to use big words, but it's just droopy breasts. And a lot of times what you look at is also where the nipple is. If the nipple is above the fold, at the fold, below the fold, depending on how droopy it is. There are different kinds of lifts. It's important to go to somebody who does all the lifts because there's the right one for you. You can't just do one for everybody. So one that just goes around the areola, there's a certain subset of patients that works. And then there's one that leaves a scar that looks like a lollipop, so they call it the lollipop lift. And then there's one other that looks like an anchor when the scar is all healed. That's kind of the least attractive one, but some patients do need it.
And I know we only have a couple more minutes here, but I want to go back to facelift and talk about Kibella. That's something that is in the news as well. What is Kibella, and does it take the place of, I guess, a neck lift?
Right. So similar to Botox, where somebody in 1972 said, hey, why don't I take this deadly poison and inject it into people, and it took care of their wrinkles. The same thing with Kibella, which is the byproduct of bacteria in your intestine. Basically, it comes from bile. And with supposedly something like 16 injections each time, it's supposed to take care of the fat in the neck. It doesn't necessarily do a neck lift, because a neck lift may also involve tightening the muscles in the neck. But the company says that it can take care of the fat. I don't do it yet. I'm waiting to see long-term results still. So far, they're only from the company. I want to see from outside sources. But it sounds very interesting for people who have a little extra fat in their neck. It might work.
And then a couple more. We see a lot of the news about Caitlyn Jenner. Do you do that type of surgery? And if so, what's involved?
So plastic surgeons are trained in doing transgender surgery. But I myself only do the reversible kind. So I have a large number of transgender patients that come to see me, and I do breast implants. So far I haven't had anybody come in that wanted the breast implants out. But I do help them in that way, that they at least can look more feminine. Friends of mine, colleagues of mine, do the actual transgender surgeries, and it's a beautiful surgery. It's very involved, and it's technically challenging, but you can really help somebody in that way.
And what is labiaplasty, and what is vaginoplasty?
So vaginoplasty could just mean plastic surgery of the vagina in any way. It could be after childbirth. It could be also transgender surgery. And labiaplasty is because it could also be a reconstructive procedure, but more commonly nowadays, you see it on the news. You can see it, in shows that certain gynecologists are doing it, and plastic surgeons. And that's just, there's no nice way to say it. If it gets floppy, then you want to tighten it. So, so that's commonly what's done with labiaplasty, is just tightening it up or taking off a piece of it.
And that can be done in the office, obviously, an operating room in your office.
It can't. That could just be done in the office without an operating room, I believe. Yeah.
Okay. Yeah. We're here with Dr. Jacob Fryman, plastic surgeon, 1800 Southwest 27th Avenue in Miami. Number's 305-446-7277. And the website is drfryman.com, drfreiman.com. Before you go, I just want to ask you kind of a curveball question. What are your hobbies and passions outside of medicine when you're not running, obviously, a very busy practice? And
so my hobbies were before I got married and had a baby, but they still are. My wife pushes me to go fishing. Nice. Fishing. I used to travel a lot, but I hopefully will do more fishing soon with the child as she grows up. I'm hoping.
Nice.
I'm brainwashing her to be a fisherman.
Awesome. I always love that question, because you never know what, I have doctors that are marathon runners, doctors that are kayakers. Yeah. You're from South Florida, so you're
I used to be a mountain climber, but not recently. There are no good mountains in Miami, so.
Well, thank you for the time and going head to toe in plastic surgery tonight. I mean, we really touched a lot of subjects. I'd love to have you back on the show in the future.
Thank you, David.
I know you drove up from Miami, so I really appreciate it. Again, Dr. Jacob Fryman. Number's 305-446-7277, drfryman.com. huge areas of interest in plastic surgery, and we found out, you have an operating room in your office. That's unbelievable. Really, really neat. Thanks again for coming on Doctors Are People Too.
Pleasure.
I make a dinner for me and my girlfriend. We ate, we enjoyed. The dinner was very good. She was ready to go to sleep. I said, okay, I'm gonna stay on the couch a little bit to watch TV. I started to feel something in my throat, like I was choking, and all of a sudden I feel the pain, the sharp pain, like somebody put a knife in your back and open and do like this. That was when I called my girlfriend. I said, you have to take me to the hospital. I couldn't die. When they were doing the test, they saw something was weird. My valve was ripped. I said, God, please help me to get out of this. Dr. Valle was on call. He was who performed my surgery. I described like an angel. I described like he was there to do that for me. My girlfriend, my son, he told me when they saw him getting out from the operation room, he was sweating. He was tired to be there for 10 hours. For me, it's unbelievable. I can walk, I can exercise a little bit, and I can drink red wine, that light red wine. Of course, 1 glass or 2 glasses. I see the life different. And I want to see my granddaughter to grow and my son to get old. So I wanna live. I think that God gave me one more chance in life, and I had to take advantage of this.
Love Katie Cakes specializes in paleo, gluten-free, vegan, and regular sweets. Whether it's a cake, cookies, muffins, bites, or delicious treats, Love Katie Cakes is available for your special occasion. Katie DiPino is a certified pastry chef. Call her at 561-635-5831. It's Love Katie Cakes, LOVEKATIEKAKES @gmail.com, Facebook, and Instagram.
You are listening to Doctors Are People Too with David DiPino, who shows us the human side of medical doctors in the community. If you have a question for our guest, call into the show at 888-565-1470. Now, let's get back to the fun side of doctors and show that they are people too.
Hello, South Florida, and welcome back to Doctors Are People Too. I'm really excited to have a cardiologist on the program next because all that's happened in the news lately with the heart. It's been sad to see with different celebrities passing away, but that just shows us that it could happen to anyone. It's important to be heart healthy and to have a physician at your call that can help you out. Without further ado, I want to welcome Dr. Pablo Urbant to the program. Dr. Urbant, how are you doing tonight?
I'm doing great. How about yourself?
Great. Thank you for asking, and thank you for coming on Doctors Are People Too. Now, you are a cardiologist at Florida Medical Center in Fort Lauderdale, among other hospitals. What is your role at the hospital in terms of providing heart care, and what's a normal day in the hospital like for you?
Sure. So I'm a cardiovascular physician. My job is, most patients have a primary physician that looks at their whole entire health, all their organs, how they are connected. My job as a general cardiologist, I am the primary of the heart, because within the heart, there's even, myself, I call upon either 5 other subspecialized cardiologists if I'm in a situation where I need help. So my role is to be a good primary for the heart and figure out what's going on and look at all aspects of the heart. It's not just the pump; it's a very complex organ. And in terms of my role, is I show up to the hospital early. I round my patients. I look at all the diagnostic imaging. I discuss with the other physicians in the care of the patient and make a long-term plan for my patients.
Now, and we talked last week. Now, you are quintuple board certified, meaning that you have 5 board certification. That's a lot of board certifications. What are you currently board certified in?
Correct. So I have board certified in internal medicine, general cardiology, nuclear cardiology, echocardiography, and vascular interpretation.
Wow, 5 board certifications. You don't see that every day. That is really impressive.
Thank you.
So let me get this right. The minimum competency requirements for a physician to diagnose and treat patients is a medical license, but that's not specialty specific, the medical license. So am I right when I'm saying a board certification is a specialty specific demonstrating a physician's exceptional expertise in a particular specialty and or subspecialty of medical practice?
Correct. The medical license in the state of Florida is just a license to practice medicine in general. The boards and the training we do, that is proving to where we work, the hospitals, that we are certified and trained in this specialty, and then we get privileges to do that specialty in the hospital. So the board certification and the special training is to allow us to do the specialty work that we do. But a medical license is just a general license that the state of Florida gives.
I see. Thank you for explaining that. And I want to ask you also about each board certification, starting with in internal medicine. What is I know most, maybe all cardiologists, have to be boarded in internal medicine. So can you explain your expertise in internal medicine?
Correct. In order to do cardiology, you have to finish a complete residency in internal medicine, which is 3 years. Myself, I did 4 years because I did a chief residency a year. And my expertise in internal medicine is just, as I previously mentioned, just being a good primary and understanding the whole entire body and all the systems in the body. Because as a cardiologist, I can't just be forget about the other systems when I'm treating my organ.
I see. And what is your proficiency in general cardiology?
All aspects. The heart is a very complex organ. There's valves. There's an electrical system. There's coronaries, which is plumbing. It's kind of like a car, to be honest. There's plumbing, electrical system, valves. There's a pump. So all aspects of the heart is where my proficiency lays.
Yeah, that's a good point. It's kind of like a car. So everything's got to be working for, the car to be performing at a high level, correct?
Correct.
Now, this one always gets me, and I always have to ask, because the way it sounds, what is nuclear cardiology, and how does that help with patient care? I think it helps with maybe diagnosis and treatments.
Correct. So nuclear cardiology is a specialized area in cardiology where we use isotopes, which are radioactive materials that we use these exams to help us guide whether we should do more invasive procedures or not. It's a non-invasive way of guiding us to see we have to do the next step and do more invasive tests, which have risk in them. So, when we're not sure to fix an artery in the heart with a stent, we do some studies to tell us in nuclear cardiology, is this muscle in the heart that we're trying to salvage alive or is it dead? So if the muscle in the heart is dead and it's not viable, why put the patient at risk for a procedure when we're not going to get any benefit of that procedure? So it kind of helps us decide on more invasive procedures after that.
Now, your 4th board certification, not that they're in order, but is echocardiography. Now, does that board certification use echocardiography use ultrasound waves, kind of like we're familiar hearing with a pregnancy, to using the ultrasound waves instead to investigate actions in the heart?
Correct. Just picture when you see a woman that's pregnant they have that probe on the abdomen, and you see the baby in black and white. Just lift up that probe and put it over the heart. That's exactly what it is. It's looking at the heart, the function, the structures, any abnormalities like infections in the heart or any masses that should not be there, the chambers in the heart to see if they're enlarged. We get a lot of information from echo, but it does use ultrasound just like the same technology for pregnancy.
Now, what is the most common heart ailment that you see as a physician?
The most common ailment we see are, I guess, the 1 and 2 would be, coronary disease, also known as heart attacks. And the second one is probably atrial fibrillation, which is an irregular heartbeat, that's an electrical problem in the heart, which is, I mentioned there's pump, there's valves, There's an electrical system. That would be an electrical issue in the heart. That would be the most common two, number one and number two, if I were to have to answer on a test.
Yeah, we're hearing a lot about AFib in the news the last, it really came to the forefront in the last 5 or 10 years or so. So
Correct,
that's
yes.
definitely something to watch. Lastly, the 5th board certification, vascular interpretation. Now, I haven't come across this before, so this was one question that I was really looking forward to having you on to answer. Now, how does being board certified in vascular interpretation help a cardiologist in being capable of diagnosing ailments with the cardio and vascular system, the cardiovascular system together?
Exactly. So most people think of a cardiologist as a cardiologist. That's the term they use. But we're actually cardiovascular physicians. We don't just look at the heart. We're supposed to be looking at the vascular system that it comes out of the heart, the aorta, the carotids, the peripheral arteries, because that's all connected. So vascular interpretation allows me, with the same technology as echo, the ultrasound waves, it allows me to analyze the carotids, which are the arteries that lead to the brain and the neck that is associated with stroke. We're allowed to look at the main artery that comes out of the body, that comes out of the heart, which is the aorta. And we can also look at the arteries in the legs for a PAD, peripheral arterial disease. So it helps incorporate the vascular portion of being a cardiovascular physician. And that's why I became board certified in that, because I wanted to have a strong understanding of it.
Now, you mentioned PAD, and that's something I've also noticed in the news a lot lately. Now, peripheral arterial disease, are there any symptoms that a person may start suffering from, that they may know that they have something? This is in the legs mostly, the peripheral arterial disease?
Most of the PAD, peripheral arterial disease, does occur in lower extremities. There are some upper extremities, but in the lower extremities, a classic symptom we worry about is when patients walk, they start their legs start to hurt, they cramp, or they start becoming very painful, and when you stop and rest, the pain goes away. That's called claudication. Claudication is a sign that you have blockages in the arteries that give oxygen to the legs, and when you exert yourself, not enough blood can get to the legs, not enough oxygen, so your legs become ischemic, meaning they're not able to metabolize and function properly. And it's the same issue that happens with the heart. The arteries in the heart, when they become occluded, you start having chest pain. Think of the pain in the heart as the pain in the legs. That's called claudication.
Now, when this is noticed, these symptoms, is it you go to a cardiologist or cardiovascular physician, or to the hospital? Is this something that if you're going to a cardiovascular physician on a regular basis, that would be picked up?
Yes, it should. We always ask about chest pain and shortness of breath, heart questions, but every cardiologist should also be asking about PAD symptoms as well, which are the ones I mentioned, because that's all tied in together, and the treatment a lot of it is very similar. So, it is very important, and most cardiologists are screening for this.
Now, is there a way to prevent peripheral arterial disease before it starts?
Really, it's the same lifestyle modification and risk stratification for the heart as for the legs. Diabetes, blood pressure, cholesterol, smoking, all the same risk factors for the heart also affect the legs as well. There's some, genetic components, and some ethnicities have higher risk of PAD than others. So we always incorporate that. But there's certain things that cardiologists can change, which are the risk factors I mentioned: diabetes, cholesterol. But there's certain risk factors I cannot change. I can't change who your parents are, your genes. I can't change that you're getting older. I can't change that, at least for the heart, that you're a male. At least not as a cardiologist. Maybe the plastic surgeon I spoke previously can do that, but I can't as a heart doctor. So that was a little joke. But,
I like that.
but it's the same risk factors, and we have to do the same risk stratification. So sometimes cardiologists overlook it because they think, I'm treating the same risk factors, but you have to really look into the symptoms because you could do a lot of good for patients. Because, in my opinion, it's a vicious cycle. If I'm telling my patients you have to do more exercise for your heart, but they have PAD, how are they going to do exercise? Because they're not going to be able to, because all of a sudden their legs hurt and they stop exercising. So then it's a vicious cycle. The PAD makes the coronary disease worse and vice versa. So it's you have to address the PAD because then they can exercise more and continue the heart healthy advice I gave them.
Now we're here with Dr. Pablo Urbant. He's a cardiovascular physician at Florida Medical Center at campus in North Shore, among other local hospitals. Now, do you have a actual office as well? Where can we find you?
Correct. My office, my practice is called Cardiology Consultants of West Broward, and the address is 7050 Northwest 4th Street, Suite 101, Fort Lauderdale. Zip code is 33316, and the number is 954-587-4112. And that's where my office is at.
And that's near West Broward Boulevard?
It's on Broward Boulevard, correct.
Okay.
It's one street off of Broward Boulevard and 70th Avenue.
Now, what age range of patients do you see as a cardiovascular physician?
As an adult cardiovascular physician, I see 18 years old, 18 and up.
Okay. 18 all the way up to 100 if someone walked into the office?
Everybody above the age of 18, I see.
Okay. That's great. Now, you mentioned carotid artery before briefly. Now, what is the carotid artery? I want to say you told us that it's in the neck, and how do cardiac ailments in the carotid artery, how are they diagnosed?
So the carotid artery is part of the vascular component. It has the same disease states as the arteries of the heart and the PAD. Once you start developing plaque from cholesterol and diabetes and smoking, once you start getting occlusions in the carotid artery supplies blood to the brain and the face. So if you have a little clot or a thrombus that leaves the carotid artery and goes to the brain, that causes a stroke. So as a cardiologist, I'm always, I just don't, like I said, don't focus just on the heart. I worry about other organs, one of them being the brain, because my job is to prevent a vascular component of strokes.
I see. Now, something that's been in the news lately is hypertension, high blood pressure, and linked to be like the silent killer is the way I've read about it recently. I know you weren't the cardiologist of the actress Carrie Fisher and actor Alan Thicke, who just unfortunately recently passed away from heart attacks. But I wanted to ask you, this is something that I noticed right away. How can people that look, like in Alan Thicke's case, he looked very fit on the outside, but then they can succumb to these heart ailments kind of, I know it can happen at any time, but kind of at a younger age than I guess we expected?
Correct. Hypertension, unfortunately, it's a silent killer. Most patients don't feel high blood pressure. Some patients have a headache, but most patients don't feel high blood pressure. And with time, high blood pressure will cause damage to the heart, the kidneys, the brain. In the case of Alan Thicke, high blood pressure what he had was an aortic dissection, where basically the main artery coming out of the heart, the aorta, dissects, splits into two, and can rupture. And that is a surgical emergency. And I don't know the details of what happened, but I don't know if he was hypertensive and uncontrolled. I don't know, but hypertension can cause aortic dissections, which happened to Alan Thicke, and MIs, heart attacks, which happened to Carrie Fisher. So just because you feel good doesn't mean there isn't something going on. You have to see your physician and get risk stratified based on it's called the global risk assessment, meaning incorporating all the risk factors for you and your age and calculating your risk and doing things that we can to decrease this risk of you having your first cardiac event, whether it be a stroke or a heart attack. So even though you feel good, doesn't mean that there isn't something going on.
I see, and thanks for sharing that with us. I know those weren't your patients, but I wanted to get your expertise on that, so I do appreciate it.
No problem.
Now, also with Carrie Fisher, her mother, the actress Debbie Reynolds, passed away shortly after Fisher died from a heart attack, and then the news right away was broken heart syndrome, and this is something that I've actually researched a little bit lately as well, because I was interested in if it's a real thing. Is it a real heart condition, and can someone actually pass away from broken heart syndrome?
Yes, broken heart syndrome is a real disease state, as we call it. The other name for it is Takotsubo. Basically, it's more common in females, but it does happen in men. Any sort of emotional or even health stress, high levels of stress, can cause what we call a transient weakening of the heart. The heart becomes weak. The pump of the heart is not working, and they come into the hospital, and what we call enzymes for heart attack, they could be elevated. It could look like a real heart attack, but when we do all our tests, there was no blockage in the arteries of the heart. It's just from all the stress, the heart becomes weak. And people can pass away from it, from irregular heartbeats, arrhythmias, as they're called, that are life-threatening. And yes, you can pass away from it.
And we're here with Dr. Pablo Urbant. He's a cardiovascular physician on staff at Florida Medical Center, a campus in North Shore, and with an office at Cardiology Consultants of West Broward, 7050 Northwest 4th Street, Suite 101 in Fort Lauderdale. Phone number there is 954-587-4112. Now, Dr. Urbant, why did you decide to become a cardiologist? I know you were originally in medical school and probably enjoyed the earlier broadcast, a little bit touching on a specialty you knew a lot about.
Yeah, so I actually wanted to go to med school at a young age, around 4 or 5, when I had a dog attacked me and attacked my face, and I had reconstructive plastic surgery. And at that point, I wanted to be a reconstructive plastic surgeon. But as soon as I started med school, I went in. We started classes on the heart, and I just fell in love with the heart because, the way I see, one of my hobbies is cars, and the heart to me was like a car, and it was very easy for me to understand the heart, the function, and how it works. So that's why I switched over to become a cardiologist.
I see. So one of your hobbies outside of medicine is cars. What are your other passions in life?
Besides, just like the previous physician, I am a new father as well. So this year has been, I've been forced to like Disney World a lot. But I do like soccer and just spending time with the family right now. So that's really it right now.
Where did you grow up, and how long have you lived in South Florida? Are you from down here?
I was born in New York, came to Miami Beach when I was 11 months, raised my whole life in Miami, and moved up to Broward approximately 2.5 years ago. And I lived in Miami in one of the suburbs, Kendall.
Okay. Nice. Now, I actually going to get through all the questions I had for you. We're here with Dr. Pablo Urbant. He's a cardiovascular physician on staff at Florida Medical Center, a campus in North Shore, and with Cardiology Consultants of West Broward, 7050 Northwest 4th Street, Suite 101 in Fort Lauderdale. Phone number is 954-587-4112. Lastly, another thing in the news is red wine in the heart. Is it true that red wine can help the heart? And if so, what kind?
So in terms of wine, before it used to be red wine, but now they've extended it to most alcohols now, actually. And in terms of wine, it's different for a man and a woman. For a man, it's 2 drinks a day, and wine, whether it's red or white, it's not a cup of wine. Or a bottle of wine. 1 drink is classified as 4 ounces. So just because I say 1 drink and you drink 1 bottle of wine, that's not accurate. 4 ounces is 1 drink.
That's important to know. Thanks so much for coming on Doctors Are People Too. I'd love to have you on in the future. We really touched on a lot of subjects.
Anytime. Let me know. Thank you so much.
All right, there's Dr. Pablo Urbant, cardiovascular physician on staff at Florida Medical Center, campus in North Shore. And thank you for listening to Doctors Are People Too.
Thank you for listening and watching Doctors Are People Too with David DiPino. Join us next week for more in-depth views on what doctors are all about and how they spend their free time. All shows can be seen on amp2.tv. And if you have questions you want answered on the air, call 866-224-5422 and leave a message that can be read on the air. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.